I am Nadine Carty-Keynes, and thank you for joining us at the Nevis Emergency Operations Center, EOC, today, Monday, 18th May 2020, for an update on the situation regarding the novel coronavirus, COVID-19, here on Nevis. I want to take this opportunity to welcome all the viewers and media houses that have joined us. All questions will be taken at the end after all speakers have presented. The Nevis COVID-19 briefings are aired on Mondays and Thursdays each week at 8 p.m. on Nevis Television, or you can check the briefings on YouTube and Facebook pages, Nevis Television, Nevis HPU, and Nevis NDMD. With us today, we have Mr. Brian Dyer, Nevis EOC Director, Mr. Lyndon David, Superintendent of Police, Nevis Division, Dr. Judy Nisbet, Chair of the Nevis COVID-19 Task Force, Dr. Veron Brooks Tyson, Senior Dentist, Oral Health Unit, Ms. Jadine Yard, CEO, Nevis Tourism Authority, and Mr. Colin Dorr, Permanent Secretary in the Ministry of Finance. Welcome to all. I'd now like to invite Mr. Brian Dyer, who is the Director of the EOC, to give his presentation.
Good evening, viewers. The 2020 Atlantic hurricane season has commenced unofficially with Tropical Storm Arthur in the North Atlantic affecting the eastern seaboard of the United States of America. Just want to appeal to our persons in the islands of St. Kitts and Nevis that even though the Atlantic hurricane season is scheduled to start on June 1st, we have had an early start, and we do encourage persons to start their preparations or complete their preparations for our reports a highly active season. The National Hurricane Center will be issuing its report on Thursday, 21st May, so all ears would be tuned in to their report. 30 other institutions have reported thus far, and all 30 have indicated an above normal season. So we look forward to receiving the Hurricane Center report on Thursday. In that regard, Disaster Management has scheduled the formal inspection of our shelters on Wednesday of this week, Wednesday 20th of May. So we appeal to all key custodians of the facilities and the shelter and shelter management teams to be on the lookout for the inspectors as they come around on Wednesday to inspect the facilities as we continue our preparation for the 2020 Atlantic hurricane season. Moving on, the statistics from the COVID-19 Compliance Task Force. As of the 18th May, we have had a total of 288 inspections. These comprise of 33 bars and snackettes, 5 bakeries and delis, 6 gas stations, 15 salons and barber shops, 19 shops, 9 restaurants, 7 supermarkets, 32 offices, 11 banks and financial institutions, 46 government buildings and departments, 2 laundromats, 53 stores, 4 market vendors, 13 buses, ferries and taxi operators, and 1 gaming room. Finally, I'd like to say a special thank you and appreciation to the volunteers who have called the EOC and indicated their availability to work with us during the hurricane season. I do applaud your efforts and look forward to working with you as the months progresses during the rest of the Atlantic hurricane season. Thank you very much.
Thank you, Mr. Dyer. I'll now like to welcome Superintendent David, who is going to give his report on behalf of the Royal St. Kitts and Nevis Police Force, Nevis Division.
Thank you very much, Nadine. Good evening, all. It's a pleasure to be back to give you an update as to the police operations regarding the state of emergency and curfew. Thus far, we have conducted 661 patrols, 68 vehicle checkpoints, 17 persons were arrested for breach of curfew and 8 have since been charged. We have 12 crimes were reported during the period and 12 persons were arrested and charged for these offenses. We had 1,696 vehicles were stopped, and out of these vehicles we would have had majority of the persons were essential workers and persons who were granted permission from the police from time to time. We also have had persons who breached. We have 10 persons who were summoned for the breach apart from those who were arrested. At this time, I would like to appeal to our enterprises and businesses to give priority to our seniors, our disabled persons, and our essential workers who have presented ID cards to you whenever they come to your establishment in order to patronize to get the necessary goods to function during the curfew periods. I also will take this opportunity to encourage all businesses and enterprises to continue to comply with the compliance unit. I want to remind you that the fine is $5,000, or you can forfeit the money that you make, the items that you are offering for sale, or you can go to prison for a few weeks. We are saying to you, avoid that and comply so that you and your families can continue to enjoy your time out. We are still seeing some shops opening and selling alcohol. We had to respond to some areas, and by the time as we got there, the persons were already dispersed. But we're saying you need to comply. Remember, the health and safety of your family members are very important. So we want to continue to thank those persons who would have informed the police, and the patrons. You do not have to go and drink alcohol during these times. If you do, well, you have to make sure that you would have had it from a long time. However, in wrapping up, I take this opportunity to thank God for his continued mercies on our federation, wherein we're not seeing any new cases at this time, and persons who are in quarantine, left, and also isolation. And for his guidance to us, the persons who are involved in the task force operations, the governments, both local and federal, for their support, my staff over here in Nevis, the police officers for their hard work and dedication, medical staff, disaster staff, and all you essential workers who have been instrumental in this so far. To you, the citizens who continue to abide by the restrictions and the guidance given, we want to encourage you to continue to do so and encourage your families. To the violators, we are saying to you, ensure that you come on this side of the fence to ensure that we wouldn't have no new cases and that we will continue to see things are happening so our country can open according to the phases that we will put out there in place to ensure that we open it fully, but with safety in mind. Thank you very much.
Thank you, Superintendent David. I'd now like to welcome Dr. Judy Nesbitt, Chair of the Nevis COVID-19 Task Force, to give her presentation.
Thank you, Madam Chair. Good evening to everyone. 124 persons have tested thus far on Nevis. 120 persons have tested negative, while 4 persons have tested positive. Currently, there are no tests pending. No one is presently in quarantine, while 242 persons have been released from quarantine. There are 4 recovered patients, and no persons are in isolation. We are very pleased that all of the students whom we welcomed home just over 2 weeks ago have tested negative and have been released from quarantine. I want to encourage them to remain safe, follow the measures outlined to them, and to wish them well in their studies. In the absence of a vaccine, and with the majority of the population susceptible to COVID-19, non-pharmaceutical interventions continue to be the backbone of the COVID-19 response. Interventions such as frequent washing of hands, respiratory etiquette, physical distancing of at least 6 feet, and the wearing of masks in public places. It is against this backdrop that the decision has been made to distribute face masks to the population. This started in the St. Paul's Parish over the past weekend by the Ministry of Health personnel and volunteers, and will continue in the other parishes at a time to be announced. Please, we plead, continue to wear masks correctly, covering both your nose and your mouth at all times when in public places, as we make every effort to stay safe. Thank you.
Thank you, Dr. Judy Nesbitt. I'd now like to welcome Dr. Veron Brooks Tyson, Senior Dentist, Oral Health Unit.
Thanks, Ms. Kathy Keynes, and good evening, ladies and gentlemen. We at the Oral Health Unit are pleased to report that our dental offices have now been partially reopened, implementing, of course, new protocols which are designed to protect both patients and the dental team. These guidelines have been reviewed and approved by the Ministry of Health. I think we can all understand and appreciate why dentists and dental staff fall in the high exposure risk category for COVID-19. This is not just because we work in the mouth and the virus has been isolated from saliva of COVID-positive patients, but more so because of the high transmissibility of the disease, and also considering the majority of the routine dental procedures generate significant amounts of droplets and aerosols. These droplets splatter onto the patient, the dentist, the auxiliary, as well as the surrounding environment, while the aerosols that are generated by the instruments that we use form a cloud in the surrounding space. As a result of this, all procedures involving any of these instruments have been postponed. These would include services such as cleanings and routine fillings. The following changes have also been made in the day-to-day operations for the purpose of prevention and safety. All patients are kindly asked to call ahead to be given a time slot. We will not be accepting walk-ins at this time. All patients will be screened prior to making an appointment and upon arrival at the office. All patients will be subjected to a temperature check before being allowed to enter into the operatory. The operatory is the area where the dentists perform the procedures. Social distancing guidelines are to be adhered to. Patients would be asked to wait outside or in their vehicles to prevent a crowd in the waiting room. You are kindly asked to wear a mask until being asked to remove it by the dentist or the assistant. All patients will be offered an alcohol-based hand sanitizer before entering the operatory. Once in the operatory, you will be asked to remove your mask, and a pre-treatment rinse will be given. While we will not be returning to full services immediately, emergency procedures will be done with all due care and precautions. Issues such as severe pain that does not respond to pain medication, swelling, tooth fracture due to accident or falls, and excess bleeding will be treated. For all other treatment, please contact our dental offices in Charlestown at 663-6041 or Gingerland at 663-6834 for advice. We can take a chance for your tooth, but not for your life. I now invite you to view a short video with some information regarding the dental office.
A message from the Oral Health Unit on Nevis about visiting the unit during COVID-19.
Visiting a dentist during the Corona scare. Hi friends, here are a few facts you need to know about your dental visit in this COVID-19 outbreak. You call up your dentist for an appointment with any of the following complaints: a discolored tooth, a routine cleaning, a broken or dislodged filling, a broken denture or itchy gums, or a dislodged bridge, maybe a hypersensitive tooth as well. And the answer from your doc is, no, not right now. Oh, you're disappointed, upset, angry, and maybe surprised with the answer. Please don't be. It's just for your own good. Yes. Let's look at a few facts. Number 1, this novel coronavirus is highly contagious and spreads by droplets from mouth and nose and surface contacts. Number 2, the virus from the infected person can be released out by coughing, sneezing, his contaminated hands and clothes. So, especially in a dental setup, a single patient of COVID-19, either in active phase or a carrier state, or just a healthy individual with corona-contaminated hands, is a potential hazard to all those who visit the dental clinic. One more thing you need to know is the equipments used in a dental clinic like aerators, micrometers, air syringe, water syringe, scalers, and physio dispensers generate lots and lots of aerosols, i.e. small droplets of water in huge numbers coming out of patient's mouth and forming a cloud in the surrounding space. Imagine the number of microbes, including COVID-19, in that cloud. Oh my gosh, yes, that's right, and it's dangerous. So most of the dentists all over the world have stopped the procedures involving any of these equipments and instruments for the purpose of prevention of infection and safety. So the dental treatment procedures are classified as elective procedures, which are not done at this point of time, i.e. COVID-19 outbreak time, and can be postponed till the situation comes under control. And at the same time, minor discomfort can be managed with teleconsultation, teleprescription, and non-invasive care. Emergency procedures, which have to be taken care of and will be performed with all due precautions. For example, number 1, severe dental pain not responding to analgesics or painkillers. Number 2, swelling over the gum or the whole of the jaw. Number 3, a fracture of the tooth because of an accident or fall. So friends, if you have any of the complaints which are classified under the emergency category, your dentist is always ready to take care of you with all the safety measures. And if your complaint is a minor one, then a strict no, and definitely no. Even your dentist says at this point of time that we can take a chance for your tooth, but not for your life. So stay back home, stay safe, keep smiling. Thank you.
Oral Health Unit emergency contact numbers are Charlestown 1-869-663-6041 and Gingerland 1-869-663-6834.
Thank you, Dr. Brooks Tyson, for your presentation. I'd now like to welcome Ms. Jadine Yard, CEO of the Nevis Tourism Authority.
Thank you and good evening, everyone. I will be providing an update on the tourism industry in Nevis. Our borders remain closed as there is no further update on when they will reopen. A majority of our hotels are also closed. Restaurants have been reopening under the guide of the most recent regulations. As a tourism authority, we have met with the various stakeholders to provide a platform for them to voice their questions and concerns. Their input have been vital as we charter our way through this interesting space. At the NTA, we have been creating strong messaging centered around safety and nostalgia, letting travelers know that we look forward to welcoming them back to our beautiful island when the time is right. Thank you.
Thank you, Ms. Yard, for your presentation. Our final speaker is Mr. Colin Dorr, Permanent Secretary in the Ministry of Finance.
Good evening, all. This evening, I report to you from the Ministry of Finance and the wider government.
We continue to take steps within our offices to observe all the health protocols and to enforce the policy of social distancing. We have enforced the wearing of masks for all staff and customers entering government offices, cleaning of surfaces on a regular basis for offices frequented by the public. We have installed markers to ensure that there are at least 6 feet social distancing for every customer entering government offices. We have also taken every step to limit the number of staff in confined spaces, and this has resulted in a number of departments operating shift system. We have also installed counter separators in offices where there were none, so as to reduce the impact of customers in the face of our workers. We have also reorganized a number of our operating procedures so as to ensure that there are very little customer-to-staff contact. This has been done through the automation of a number of our manual procedures and in making greater use of online filing for documents. For example, at the Financial Services Department, registered agents now submit all their requests by email. Provision is also made for a drop-off box for the hard copy of documents from these agents. All health protocols are observed when dealing with these hard copies of documents. At the Inland Revenue Department, we have beefed up our online platform where taxpayers can now file and pay their taxes online. For those persons who do not have an online platform, provision is made for your request to be sent by email and also for the hard copies to be dropped off at various points during the course of the day. Again, all health protocols are observed in dealing with these hard copies of documents. We are aware that person-to-person contact is the fastest way of spreading COVID-19, and as such, all efforts have been geared towards limiting the amount of people-to-people contact in all government offices. COVID-19 worldwide has both a health and an economic impact. Here in Nevis, we continue to assess the impact of COVID-19 on our economy. The resulting close down of businesses in the latter part of March and early April brought economic activity to a halt. We are happy that business entities have started the process of reopening, even with limited hours, so as to keep some level of economic activity going. Our economy, which is driven by tourism, contributing at least 1/3 of business activity, this sector is one which is hardest hit due to the closure of our borders and the resulting closure of our hotels and restaurants. In addition, our small business sector is also greatly affected, as the revenues of these persons to a large extent were derived either directly or indirectly from the tourism sector. What this has taught us is that businesses must now rethink the way they do business and must now seek to implement new measures and new policy to service their customers. The use of online services for customers where items can be purchased online, the use of delivery service for persons who do not wish to venture into large gatherings are some measures which businesses must adopt as we go forward into 2020. The Ministry of Finance stands committed to working with all businesses to ensure that a new approach is adopted as we seek to revive economic activity post-COVID. Thank you.
Thank you, Mr. Dorr, for your presentation. I'd now like to open up the floor for questions from our media persons. I have a question from Shamika Budgen of On Radio. It was mentioned in a briefing sometime last week on St. Kitts that a number of daycare centers were open without seeking permission. Are we experiencing such acts here on Nevis?
Thank you, Shamika, for that question. We are not aware of any of the daycare centers being open right now. However, the Ministry of Education would have been the best institution to answer that, but there are none of them here right now. No one is here right now from that department, and therefore we are just unaware of any daycare centers that are open right now.
Thank you, Dr. Nisbet. Thank you, Shamika Bajan. On radio for PSL Finance, Mr. Dorr. Can we get a breakdown on the list of taxes that are to be paid currently by businesses, as some businesses are currently closed due to the COVID-19 pandemic?
Thank you, Ms. Budgen. If we look at our tax cycle, the month of June, which would be property tax, that one will be due next month. On a regular monthly basis, we have our VAT, which is value-added tax, which is filed on the 15th of each month. The quarterly return for corporate income tax, that was due in April, but we have provided an extension, and therefore persons who file after that date, we will not penalize them, but we encourage them to file within the time period based on your own situation. So those are the ones at the moment which are due for filing, and also the unincorporated business tax, which is also due on a quarterly basis. What we have done basically, in considering what has happened, we have been working with the businesses. While we encourage you to file, we are not in any way going to enforce any penalty at this stage for those persons who are not able to put their filing together because of the impact on their business activity.
Thank you, Mr. Dorr. Thank you, Shamika. We have our final question. It's from Von Radio. Can we get a report on the opening of beaches? Are persons complying with the timing, 5:30 to 9 a.m.? Has anyone been caught after 9?
Thank you for that question. At this time, we have not interacted with anyone for breach of this particular regulation. However, we continue to monitor, and we know that as time goes on, someone will be able to let us know, look, this particular person or this particular set of persons are violating. But we will continue to monitor, and at this time, I will take the opportunity to encourage persons to just follow the protocols and the restrictions and the guidance given regarding these regulations for our state of emergency and curfew. Thank you very much.
Thank you, Superintendent David. Okay, I would like to say thank you to all our presenters, and for persons to remember to follow the instructions given under the state of the emergency. Additionally, I just want to remind persons to be safe and protect others by washing your hands with soap and water, cover your cough and sneeze with a tissue or flex elbow, and dispose of tissue immediately in a closed bin, and wash hands. Avoid touching your eyes, nose, and mouth with unclean hands. Disinfect touch surfaces often. Eat fruits and vegetables. Drink lots of water and exercise. Practice physical distancing, that is staying 6 feet or so away from another person, and stay safe. And remember to stay at home if you don't have to move about. Our hotline number is 311 or 661-5051. A reminder to sign up for the Nevis Health app at kn.unhin.org. I want to say thank you to the Nevis Disaster Management, Nevis Television, Caribbean Digital Displays Limited, Cornerstone, and members of the Nevis COVID-19 Task Force for making these briefings possible, along with you, the viewers. I am Nadine Carty-Keynes, and please join us again on Thursday, 21st May at 8 p.m. for another Nevis COVID-19 EOC briefing on Nevis Television. Thank you for viewing, and please stay safe.